Hello and welcome to SARC Publisher, and today we're discussing chronic spinal disorders and the role of MRI in diagnosing them. Chronic spinal issues are on the rise due to poor posture, sports injuries, weight gain, and repetitive strain. Many of us don't realize how daily habits like improper sitting or lifting can lead to long-term spine damage. MRI scans play a crucial role in diagnosing spinal disorders, but traditional static MRI has some limitations. When a patient lies down, the force of gravity shifts, sometimes masking conditions like herniated discs or spinal instability. That's where flexion MRI comes in. It allows doctors to see how the spine reacts under stress, revealing hidden issues. While MRI remains a gold standard for spinal diagnosis, understanding the right imaging technique is key to accurate treatment. So we have conducted a study, and the study involved data collection from 140 Iraqi patients suffering from spinal disorders across multiple hospitals in Iraq over a period of 1 year, 3rd September 2022, 1st February 2023. The study focused on individuals aged 30 to 50 years who underwent magnetic resonance imaging, MRI, to diagnose spinal conditions. The study used SPSS version 25 for statistical analysis, employing mean enlightening insights, standard errors, and Pearson chi-square tests, p-value of 0.05, to assess relationships among variables such as age, gender, and MRI findings. The MRI scans were performed using GE MRI 1.5 Tesla, a widely used clinical imaging device for lumbar spine evaluation. The procedure requires the removal of metallic objects and patient rest to ensure optimal imaging. A spinal coil wrap was utilized, and the scan duration ranged between 30 to 60 minutes. MRI, magnetic resonance imaging. Scanning uses strong magnetic fields and radio waves to generate detailed images of internal body structures. The patient lies inside a cylindrical scanner, while the machine captures cross-sectional images for medical diagnosis. Common spinal disorders include herniated disc, displacement of disc material pressing on nerves, spinal stenosis, narrowing of the spinal canal, scoliosis, abnormal curvature of the spine, degenerative disc disease, wear and tear of spinal discs. The most common symptoms of spinal disorders, including persistent back pain or tingling sensations. It also highlights potential numbness, weakness in the limbs, and changes in bowel or bladder function. Recognizing these symptoms early can prompt timely medical evaluation and potentially prevent further complications. This study finds the distribution of spinal disorders identified through MRI scans. About 50% involve bony abnormalities, 28.5% are disc-related issues like herniation, and 21.3% are spondylodegenerative conditions such as arthritis. The pie chart and bar graphs offer a clear snapshot of how frequently each category occurs, helping doctors prioritize diagnosis and treatment. In the end, we can say that MRI scans are easy and safe, and no health risks have been associated with the magnetic field or low-energy radio waves used in the test. The procedure can be repeated without side effects, where in this study, a direct relationship was found between spinal disorder and MRI diagnosis. Thank you for watching.